Hi, I'm Mikkel Becker.
And I'm Debbie Martin. Does your pet struggle when you try to give oral medications or even apply topical medications? If so, you're not alone. Lots of pet owners have difficulty applying needed medical treatments at home. Your dog or cat's not trying to make your life more difficult. They're actually frightened about the situation. They're worried about what you're trying to do, or maybe it smells funny to them and it creates fear and anxiety, and they're just trying to avoid that situation. We want to make sure that your pet doesn't start running for the hills when they see you coming with medication bottles or treatments that need to be done, because we want to create a great relationship between you and your pet. And if they're stressed out about needed medical care, either one, it won't get done, or two, it's going to damage your relationship with your pet. So we've got some great fear-free tips on how to make this a more enjoyable experience for you and for your pet.
When providing medications to your pet, do so in an area where your pet is comfortable being handled. This could even be something like their treatment station where they're trained to go to for different types of care. Avoid leaning over or looming into your pet's space as you apply the medication or give that medication to your pet. Ideally, get on the same level with your animal. This might be by having your pet next to you while you're relaxing on the couch, or it might be actually kneeling or sitting down on the floor. That way you're more on your pet's level. You can cleverly disguise medication using the 1-2 treat method. This involves using at least 3, but you could actually use more than 3 treats. The first one is that promise. This is the actual treat without any medication on the inside. This gets your pet eager and excited to take those treats that are in your hand. Now these can be delivered directly to your pet's mouth, or you may even toss them for those pets that like to chase after that treat, or that can actually catch it in the air. That way there's that high excitement about it. Secondly is the deed. This is the treat that actually encases that medication on the inside. And lastly, follow up with that chaser. This is the treat that doesn't contain any medication and is really tasty, so your pet is really excited and eagerly takes down the pill-containing treat to then follow up with that really good tasting treat or multiple treats at the end.
The 1-2-3 treat method can be a great way to disguise medications. However, some medications are pretty bitter tasting, and if they get a taste of that bitter tasting medication, they may avoid the treats altogether. You might talk to your veterinarian about having certain medications compounded into a liquid or a treat form that tastes better and has less bitterness to it. You can also proactively teach your pet to like bitter tasting items. You do this by diluting something like lemon juice or even something that is a little bit bitter and having your pet eat it, and then following it with something really great. The predictive value of, I eat this thing that maybe tastes a little bit bitter, but then I get something really great, can teach the animal to go ahead and eat those bitter tasting things to get a greater tasting thing at the end. Kind of like when grandma had you eat your vegetables so you could have dessert afterwards. Another way to disguise bitter tasting medications is to use a gelatin capsule. Check with your veterinarian to make sure that it's okay to put the medication into a capsule. Regardless of if medications are bitter or not, it's really important to reward your pet for taking those medications, because they know, even if we've disguised the medication, that they're getting something in there. Their sense of smell and their sense of taste is quite amazing. So they know something's hidden in those special treats. Make sure you follow it up and reward them for taking those medicated treats. Ideally, medication should not be involved in your pet's regular meals, especially with cats, because if you put the medication hidden into their regular food and they get a bad taste from it, they may start to avoid their food altogether, which could be really detrimental to their physical well-being. Ideally, provide medications at a time your pet is more eager to eat, such as right before a mealtime. Give the medications, reward your pet for taking them, and then give them their regular meal.
Beyond cleverly disguising medication inside of treats, you can also get your pet comfortable with the handling process for actually being pilled. This may be delivering a solid pill or a liquid medication to your pet. To do this, you want your pet to be comfortable with their mouth being handled and with that pill or with that liquid medication being delivered. To do this, start by getting your pet comfortable with handling around their mouth. Always take special care around the whisker area, which can be quite sensitive for that pet. What you can do is start with just gently lifting or touching the side of that pet's mouth and deliver a treat. If your pet is comfortable and relaxed, you can eventually graduate to a more advanced level. This is where you can actually handle over the top of your pet's mouth and deliver that treat, and eventually start lifting your pet's lips and giving a treat. And after that, what you can start to do is start to handle the bottom of your pet's lower lip or their jaw and deliver that treat. And eventually we are going to do a slight lifting up with either 2 or 4 fingers on the opposite side of your pet's mouth while your thumb is on the other. We're going to deliver that treat. And then we may also start to gently lower that jaw, so just gentle handling there to kind of open that trap door, deliver that medication, and then close it for that pet to swallow. If we do this with our pet proactively with treats, we can encourage them and help them to feel more comfortable if we ever do need to medicate them without actually having treats, as may be the case if your pet is really ill and doesn't feel like eating, or if it's medically contraindicated. To get your pet comfortable with having liquid medication, you can start to do the similar handling around the pet's mouth. But instead of doing the actual lifting up and opening of the pet's mouth, a lot of times you can just have that liquid syringe placed on the inside of that pet's mouth. And then what we can do is just gently squeeze that liquid medication on the inside and encourage that pet to swallow. We want to do this initially with some really good, enjoyable treats that pet enjoys. So this could be some diluted tuna juice, some diluted chicken broth, or some canned pet food that's just gently diluted with some water to make it easy to squeeze into that pet's mouth. You can also get that pet comfortable with taking that liquid medication by doing so in a way where you actually teach them to take some type of medication that doesn't always taste really good, but then always follow up with that really enjoyable treat. So for instance, you may actually deliver water through a syringe into the pet's mouth, and then afterwards follow up with that tuna juice or with that chicken broth. That way your pet has that happy enjoyment and that really good anticipation. After you're done pilling your pet, you can gently massage their throat area. This encourages them to swallow to ensure that pill goes down. In some cases, that pill may actually get stuck inside of that pet's throat if their mouth is really dry. So you can encourage them to fully swallow and to get that pill all the way down by giving them something like a little bit of diluted chicken broth or beef broth inside of a syringe. So this helps to make it a tasty treat that also helps that pill to go all the way down. When pilling your pet, you always want to give them the option to move away if they're uncomfortable. But you can help to encourage them to stay in that area rather than backing up or moving away by getting them in that comfortable space, such as on that non-slip surface, and you may have them next to a wall or next to the chair to discourage that backing up and to help them to stay in place. But if your pet is uncomfortable and they make any attempt to escape, always allow them to exit. We don't ever want to make them feel threatened or cornered.
Now that we've talked about giving oral medications, let's talk about topical medications. Many heartworm and flea preventive medications are actually applied topically to your pet, and they can provide their own challenges, such as the odor of the medication or some of the things that you need to apply the medication, such as gloves, the bottles, the packaging. Those can all be frightening experiences for your pet. Start your treatment in a place that the animal feels comfortable, such as their treatment station. Make sure the animal is allowed to investigate the object that's in your hand and smell it, and follow that up with a great treat. Next, make sure that you're not leaning or looming over your pet when applying the medication, so kneel down next to them and be at their side, and watch their body language to make sure they're not trying to avoid you or escape from the situation. And if they remain calm and relaxed, go ahead and apply that medication and then follow it up with a really great treat. Another option would be to have someone standing next to your pet, giving treats throughout while you apply the medication. Make sure if you're wearing gloves that your pet's comfortable with the gloves being on your hands prior to actually applying medication.
Note that when applying topical medication to your pet, it may be in an area that your pet is more sensitive with, such as behind their shoulder blades, which may involve that hand reaching over them, or it may be in a place like their paw. So in order to move towards those more sensitive areas, start off in an area that your pet is more comfortable being touched, then gradually transition to that area where the treatment will take place. For instance, you may start off on the pet's shoulder and then gradually move behind the withers or down to the paw. And always watch your pet's body language to ensure that they're staying comfortable, and reward them throughout that entire experience. When it comes to rewarding, having that helper on hand can be really helpful on easing that entire process. However, if you are doing this on your own, there are still ways to encourage your pet to stay in place and keep them calm and comfortable. You can do this by placing a spreadable treat on a vertical surface, or you can have a food puzzle that's placed in an area that keeps it stationary while your pet enjoys that lickable treat. You may also deliver treats intermittently throughout your handling, so you may encourage and reward your pet for staying in place and help to pair those positives with the entire experience. Following these tips can make the entire medication process more fear-free for your pet. For more ways to put the treat into treatment
And take the pet out of petrified,
go to maddiesfun.org
or fearfreehappyhomes.com.